to help a whole lot.
May help some, but not quite as much as if he was a year old.
Right.
If you catch him before some of the objectionable behaviors get going, it's much easier to keep them all the way gone. So that's some of the things that deal with some of the medical side of spay and neuter, and those surgeries are easier and better to do when they are a normal, healthy young animal. They just handle things better with the anesthesia and with the whole procedure. Recovery is faster. So
What's the recovery time from that?
I use recovery time. I figured in three ways. One is sensations and feeling and pain. One I deal with is the anesthetic protocol, and the third is the tissue healing. So, in getting those three this is making oversimplifying it quite a bit, but the anesthesia usually is out in hours to up to 2 days or 3 days, depending on what's used for anesthesia. Gas is out much faster than injectables. Injectables take longer to work their way out, up to a couple of days sometimes to get the weird little behaviors out, and occasionally they'll vomit something, or occasionally they'll be groggy or cough some. So there's some little things that come up from some of the anesthetic things that last longer, but gas out very fast. So the pain sensations are typically like any of us have surgery. There's more discomfort the first 2 days, and then that discomfort begins to fall off. And we do send home usually some pain medicines with the dogs and give them a pain shot at surgery time to kind of help decrease that as they go home. And that usually is better. Within a week, the pain sensations are usually pretty minimal in spay and neuters and those kind of things. Tissue healing is a continuous process. It starts on day one and it continues on for months and even a year, mostly to the invisible to the naked eye. You don't see it happening inside, but as far as what we consider healed functionally in the household, usually a couple of weeks is what you see healed. So
Does this type of surgery, spay neuter, does that require an overnight stay at the vet, or can it?
Most cases not. We're doing them mostly as outpatient that come in early morning, leave late evening, late in the afternoon. In most cases, there are times it goes overnight. If one has some difficulty in the surgery, or if one has something that bleeds more than others, if some blood don't clot as well as others and it bleeds more, we'll keep those overnight. Not common, but occasionally. The other ones that stay overnight is if before the spay happens, some major emergency crashes through the front door, hit by a bus dog that has to be worked on a while, and the surgery gets bumped back to the afternoon, I don't send him home asleep. So I may do it in the afternoon and then let him watch him overnight, make sure he's okay overnight, and then next morning send him home. But 85-90% of them go home same day, as long as they get there early in the morning and they get their stuff done on time. If they're supposed to come in at 8 and they come in at 11 o'clock, we miss their spot, then we try to get it done still, but he may not be going home that night. So,
Right.
But for the most part, they go home overnight.
Well, one of our favorite holidays is right around the corner on Monday, the 4th of July, but most of the dogs and cats and just about every animal doesn't think a whole lot of the 4th of July, do they?
That's quite true. We do have a lot of calls and a lot of difficulties with all those noises type of noises that worry the animals. Some dogs get pretty anxious. Some get some behavioral things that go on funny. Tends to be a little more in old dogs than young dogs, and cats tend to sullen and hide more than dogs that get a little more agitated, a little more active, a little bit. They start getting more physically active, where the cats usually go and hide somewhere.
Is there a type of drug that you could prescribe just for this time of year?
Yeah, absolutely. There actually are some behavioral things and just some basic management things that can be done without medicine that help some, but sometimes medication is kind of needed. So things that can be done management-wise. Sometimes during the times when usually starts at about 5:30 or 6 in the evening, and it goes on until about 10 at night, and then it kind of slows down. But during that time frame, if somebody can have a place for a dog, an interior room that is away from the walls, away from outside, I oftentimes will put thick, like comforter or a big thick something on the floor that doesn't transmit vibrations through the floor very well. Turn on some music or a white noise machine or something that kind of covers all the noises. A lot of times dogs do better like that until they come back out at 10 p.m. and they just kind of settle down and they can get out. So that helps sometimes to have them in a place where they're closed off, in a place they don't hear all that banging and whistling and everything. So that helps sometimes. Also, having being sometimes with family or with people tends to help a little bit, as opposed to just out the pen by themselves. Sometimes it helps a little bit. One thing we do see that affects the level of anxiety, it actually is a reverse effect of what we think is going to happen, and that is because they're different species. They're not humans. They're dogs and cats. And very often in human society, when someone's anxious, we go hug them, say, "Hey, it's going to be okay. Don't worry about it," and just pet them a little while, and they do better. Dogs aren't human. They don't understand those words. All they know is every time I get nervous, I'm getting petted a lot for it. And so sometimes too much physical affection encourages that behavior. It actually enforces it and makes it worse, because they're getting a lot of love when they get nervous. And so that should be looked at carefully about when to give the dog a lot of positive reinforcement when they're having a behavior you don't want. So that's to be a little careful with that part. Sometimes it makes it worse. So skipping on now to things that can be done medicine-wise. For a long time we've had something called acepromazine, and it can be used, and it's a sedative, and it can be used. It tends to last quite a while, and the dogs get kind of dopey. They just get, some people don't like the, droopy eyelids and all the kind of laying around panting, but just kind of makes them dopey. There are some newer ones that tend to do a little better. In many cases, like one called trazodone, just takes the edge off, kind of takes them a little bit of that kind of nervousness off for 4 to 12 hours, and it sometimes is kind of useful. So it can be helpful in a lot of dogs, in particular. There also is something called Sileo, which has been out now for a few years. It's a little paste gel, and it actually is quite good for 4 to 5 or 6 hours. It takes about an hour to take effect, but it really is good about taking the edge off. It really takes that anxiousness away. And they usually, I think, I don't remember the tube size. It has enough for usually, depending on the dog size, anywhere from 2 to 5 doses, 6 doses, depending on the dog size. And it's a little bit cost. It's about $20 a tube. I think it's kind of high, but it does get enough for several nights. And so, if a dog really has troubles and it's worth $4 or $5 a night, sometimes it's useful to do that. So.
Now, if somebody wanted to get some medication to kind of keep their dogs calm over the holiday, is this something where you need to have an office visit to actually kind of look at the animal first and get a better idea, or can somebody come in and say, "Hey, I want some trazodone"?
Okay, there's a law that tells us, and the law says essentially that if we have a previously established veterinary client-patient relationship where we have interacted and talked and we've seen the animal and examined and kind of have an idea what's happening to that animal, and we have a clear understanding of what's happening with the animal's behavior, and I can understand clearly what's happening, then they can. If they're an established patient in the last 12 months is what the law says, that I have to have seen the animal in the last 12 months to say that I know adequately what's happening. If I seen him 5 years ago, things have changed, and it's been so long. I'm not sure with that animal now, but the law says 12 months that I can send home certain things. If the information is adequate to decide what the proper medicine is, we can send some of those home. But if I've never seen before, I'm not allowed to do that by law. I can't just send things home just without ever seeing anything, without knowing anything, without, I'd say we've seen it for vaccines last week, and I having good information about what it does in fireworks, I can do those things because I know the dog, I know what's happened, I know the owner, and I know, the background enough to do it properly. So, and they're just trying to avoid misdiagnosis and mistreatment, and I understand it's
Right. Again, if you have any questions that you'd like to ask Dr. Kyle, right now would be the time to do it. Number to call, 729-6659. A lot of times, sometimes dogs are just like people. They need to make sure that their ears are clean, and sometimes they get allergies to certain foods that can cause a buildup in their ears. What's the best way to clean those puppy dog ears or kitty ears?
Yep. As far as typical cleaning, there are some actually decent cleaning products that are made for dog ears that you can soak it in there, saturate it in there, give it set a minute or two, let them shake out the excess, and then I like to use like a little hemostat with a cotton swab, and just grab that cotton swab and then just run around there, and that way the cotton swab covers all the points of the hemostat, doesn't damage the ears. My first question always is, what are we cleaning out? And if we're cleaning out a little tiny bit of orangish wax, that's normal to be in there, then fine. If they're cleaning out a bunch of black gunk or a bunch of brownish smelly gunk or a bunch of yellowish pus looking stuff, there's something wrong with those ears. And then it's time to figure out what's wrong and solve it and fix the problem, and then the stuff will go away. But many times if there's much in the dog's ears, something's wrong. They shouldn't have a lot of stuff in their ears. They maybe just a little bit of wax and that's it. But if there's very much, something's wrong.
Yeah, our dog had a lot of black stuff in his ears, and turns out he was allergic to probably either chicken or beef.
Right.
And we had to go with, is it the hydrolyzed protein?
Yep.
Yeah.
Yep.
And you probably, I know you've got, can get some food with hydrolyzed protein in.
Yep, Purina makes a good one, and then Hills makes a good one. IAMS makes a good one. All three of them make good products. So we do occasionally have patients that are on that. Yeah. So.
Yeah. We talk a lot about dogs, but the cats are pretty popular pets too. What if you have two cats that are indoors? Can they use the same litter box, or is that
the experts? And I deal with cats, but as far as being like a board certified behaviorist specialist, I'm not that. We deal with cats a lot, but it's the experts, the behavioral specialists say that the number of litter boxes you have is equal to the number of cats plus one.
Oh,
So if you
okay.
have 2 cats, you ought to have 3 litter boxes. And if you have 5 cats, you ought to have 6 litter boxes. That's what they say, and there are some good reasons for it. That litter box to us is a place with some clay in it, and it has to be emptied every day or every couple of days. To a cat, it's a very different world right there. That is a very susceptible place to problems because animals mark their territory with urine and with feces. And when they go into a place that has tons of urine and feces, they're wondering if somebody's going to guard this. Is somebody going to jump on me for being in here, or can it's a very worrisome place for a cat.
They could probably, I guess, they could spread disease that way too, from one to the other.
There are some worms that can be in feces. Cats spread not as bad as dogs because they cover their feces, or some do. They're supposed to. Some cats never got the message, but
Right.
but they're supposed to. But the way they cover things and they do things, it is a little bit less spread of some of the worms than there are in dogs. The odd part of it is the worm that you see, the tapeworms, when you see pretty often, they aren't spread through feces much. They're spread through either swallowing a flea that's infected with the worm inside the flea, or by catching a rat, rabbit, or mouse and eating it that has a tapeworm inside of it. So it's not spreading the feces. The ones that are spreading the feces are actually, oddly, the bad ones you never see in the stools. They're never visible. I've never seen them in the stools
Okay.
in 26 years of doing this. The bad worms are not, you don't see them. You don't see them in there. And so
Right,
I
right.
constantly have people come in and say, well, I think he's fine because I haven't seen any worms in his stools, but I have cases constantly where having sick dogs come in with, they've never seen a worm, and I don't see them either, but microscope shows all the eggs, and I think he's loaded up with worms. And so don't expect that you'll see worms if they're the problem. They're not visible sometimes, or usually.
Yeah.
So.
You know, a lot of times you'll be playing with your dog, or maybe kind of wrestling around if you got a big dog, just kind of having fun. Or, sometimes you're playing with your cat as well, with a piece of string. If that animal would happen to break skin, whether with a claw or not a claw, but a nail, or with teeth, but they're up to date on their shots, is there anything you need to be worried about?
For the most part, if a dog is current on his rabies vaccinations, that the bite to break the skin should be looked at by somebody in human side medicine. But the likelihood of is almost in almost gone of having rabies transmission on a dog who is playing with somebody and is up on his vaccines and has been currently vaccinated. When the first thing we see as far as a bite goes is if that dog is not acting normal, and to play rough and break skin a little bit in a rough play is not considered abnormal. That's just rough play, and somebody's being
Right.
being a little bit anxious. However, if they're current on their vaccines, if a dog is shedding rabies virus, which he would have to have been bitten by a rabid animal previous, usually 1.5 to 6 months earlier, had been bitten by a rabid animal, then if he is shedding virus in his saliva and can give it to somebody else, then he will be dead within 7 days.
Oh, okay.
He will die very rapidly. So if someone got bitten and their dog dies unexplained with the neurologic signs within 7 days, I would have him checked, have his head checked, and and then we know that person needs to start getting their shots to prevent it.
Right.
That scenario is actually quite rare. Now, when somebody's on the street and they scare a dog out of the bushes and he bites them because they don't know the dog, don't know who he is, that's more common type of thing. And those dogs, if we don't know their vaccine status, then it's a little more worrisome. But
Right.
that's.
Now, we had our dog in, about 2 weeks ago,
I think so, yep.
I guess.
Mm-hmm.
I think I saw a sign in that dogs and cats, I suppose, that are there to be seen by you, they need to be up to date on their rabies vaccine, or you need to get it done
Right.
at the time.
That actually is a legal requirement. Every city and states also have rabies laws, and it's kind of an odd thing because the likelihood of them getting distemper or parvo or other things is actually a higher chance of getting those things, and the dog can get sick and die from the other things more likely. But we don't get those things.
Oh.
And since we get rabies, we can die from rabies. That's why it's a law. The dog has to have it. And so they serve as kind of a safety buffer zone between us and those raccoons out there and the things out there that the dog might run up on and get interacting with, where we don't have as much interaction with them. So
Right.
it's required by law everywhere, because once you get rabies, now I need to explain this first, but once you get rabies, you're dead. It's game over. Now, when you've been bitten by a rabid dog, you don't have it yet, but you've been exposed to it. And so you can get shots and treat yourself with vaccine type things and prevent yourself from getting it. But once you have it, game's over. I think there's been 6 recorded survivors in history of the world of rabies.
Really?
So once you have rabies, you're done. So that's why that's why the law requires it.
So how long did you say it takes for it to kick in?
Okay, it depends on the distance of the bite site from the brain. And so, because that the virus will reproduce at the bite site, and then it will begin to migrate up nerve to get to the brain, and the brain's where it wants to be. And once it gets in the brain, it will reproduce all over the place, and then start emerging back out in nerves that go to the mouth and the tears and other places like that. So, if the bite's on the ankle, it's probably gonna take 5-6 months. If it's on the shoulder, it might take a month and a half. So
Right.
depends on how far it is from the brain.
So if you get dog bit and you're not sure about the dog, you probably better begin the series of shots.
Well, your human healthcare provider will give you information on that. We get calls sometimes from human healthcare providers to get some details on because we deal with rabies more than human healthcare does. But get a hold of them, talk to them. I'm not allowed to comment much on human healthcare because I don't have a license for that. But that is something that in animals we do deal with those questions sometimes. And so
Right.
if you do get bit, see your human healthcare provider. They can probably give you some information and go from there.
Is there anything else you'd like to cover while you're here today?
Just everybody watch out for the ticks and fleas that carry you away now. They're getting bad. They have been for a while there. So
Well, maybe we'll get some cold weather and
fall will get here. Yeah.
yeah, fall will get here at some point.
Yeah.
Maybe.
Yeah, maybe.
We'll keep our fingers.
We're not there
crossed.
yet. But,
Yeah.
anyway, so.
Well, Dr. Kyle, I appreciate you dropping in today. Again, give us your address.
We're at 403 North Henderson Street, say down near the police station and the library, down old downtown. And phone number is 729-6100. That's 729-6100.
And appointments are always a good idea.
Yep, we're fairly full, so every now and then we can fit one in when they walk in, but usually it's got to find an open place for them. So, yeah.
Okay. All right. Well, I appreciate it, and we look forward to talking to you next month. All right. That'll be the last Wednesday in July when Dr. Kyle will be back in. 23 minutes after 1 o'clock, we're at 87 degrees. We will take a look at the forecast right after this.
Wofford Brothers Plumbing can handle all of your plumbing needs from sewer clean out and plumbing repair to new construction, residential, and commercial plumbing.